Hey y'all, it's John Mark. There's a war going on right now, and without doubt, most of y'all are probably paying very close attention to that, and that's a good thing, But it's during these times like these where certain parts of the government are that aren't actually or directly executing the war. They're busy doing things that can have a huge impact on all our lives, particularly veterans. And now, I'm not suggesting that agencies like the VA are doing anything nefarious. Please, it's not what I'm not wired that way. But coverage of the war does provide a bit of a smokescreen for the VA to enact important reforms that can change the way veterans received care. And I made a point while everything was kind of unfolding in the Middle East to do some research, about a week's long research into a particular proposal that is kind of being kicked around now in the policy space. Actually, it's not being kicked around. They're starting implementation, and that is the restructuring of the Veteran Health Administration. I'm going to condense my research and some of my findings into about a 15-minute segment. Talk about the problem, talk about the recommended proposal, some of the pros, the cons, and give you some practical tools that you can use to help you share your thoughts about these reforms with the people in a position to actually carry them out. Now, I'm not going to share my opinion here. That's not the point, right? We're grown-ups. We have our own brains and we can form our own judgments. My only goal is to share what I've learned so that you are in a position to act as you see fit. That's kind of in line with the values of this channel. We're not going to teach people what to think. We're going to lay things out as complete as we can in a concise as way we can, and members of the veterans community, grown-ups, can make determinations about the direction they want to go with any kind of pushback or support. The question that we should all keep in mind as we consider any VA policy effort is simple. Does the system, that is the VA and the broader healthcare system, actually have the capacity to take care of our veterans? So what changes am I talking about? Well, if you've been following the news, you've probably seen headlines about the restructuring or consolidating elements within the Veterans Health Administration. Now, before reacting to that, stay with me now and stay with me through all the visuals in this episode, because they're going to help you, I think, see like what we're talking about. If we're going to move through this step by step. So before we dive in, context matters. Look at the map here and consider the scale. The Veterans Health Administration operates more than 1,200 facilities and serves millions of veterans annually. I mean, just to put it in proper context, it is one of the largest healthcare systems in the entire world. Now, why does this matter? Well, obviously, restructuring something this large is not a small endeavor. And as with any organization, structural reorganization within the VA will bring about some pretty dramatic changes to the delivery of healthcare to veterans. So what structural changes will be made? Well, the proposal focuses on the management layer of the VHA, particularly the regional structure that oversees hospitals and clinics. Now, take a look at this map. Right now, the United States is divided into 18 regional networks called VISNs. I don't know what the acronym is. Sorry about that. The plan, as I understand it, is to reduce the number of regional networks from 18 to 5. This reorganization can involve consolidating some of those regional networks, reducing administrative layers, and adjusting reporting lines. Importantly, and I want to be clear here, this is about management structure. It is not a proposal to eliminate VA healthcare. It is not a shutdown plan. The stated goal is to simplify operations and to improve decision-making speed. Now, I say that and I emphasize that because, there are a lot of advocacy groups out there. There are some headlines that would suggest otherwise, and that's just not true. Now, look at this diagram. Supporters of the reform argue that over time, administrative layers accumulate. That's just basic one-on-one bureaucracy growth theory. And what they're aiming for is like less duplication, more direct accountability. That's a streamline argument. Fewer layers can also mean fewer buffers. We're talking about less regional oversight, more centralized authority. The same structural change can be interpreted as efficiency or as centralization. That's really what it boils down to. It comes down to centralization versus efficiency. And that's an important thing to keep in mind as we kind of move forward in this slide. Let's zoom out a little bit here. Take a look at the timeline. Reorganization within the VA, it's not a new thing. You can see, there was a big one in the 1990s. We had the Choice Program, the Mission Act. I think many of the viewers are probably familiar with the Mission Act, the PACT Act. And, I think that this context is important because it frames it as this is just another stage of evolution. There is precedent for the way that the VA has traditionally done reorganization. And that is a key difference, I think, for this one versus what we've seen in the past. And we'll talk more about that later. And that brings us to community care. Now, look at this chart. Community care is when veterans receive treatment from private sector providers outside the VA system. But it's important to note that the VA pays for and coordinates that care. It's triggered when distance standards aren't met, wait times exceed time thresholds, or services aren't available locally. Now, since the Mission Act, community care spending, as you can see, has grown substantially. Now, why is that? Well, eligibility obviously expanded, right? And access standards expanded, demand increased. I think this is one of the most important strategic trends shaping the policy debate around restructuring. And to make matters worse, our Vietnam vets are getting older. Our Global War on Terror era veterans who participated in over 20 years of combat are also getting older. And it seems reasonable to assume that this trend is going to continue into the next few decades, right? So the other strategic trend that we should talk about is staffing, right? Not just within the VHA, but also within the larger U.S. healthcare system. Remember, community care depends on the capacity of the external system to look on VHA patient demand. Now look at this image. The strategic trends couldn't be more clear. There are national nurse shortages, mental health provider shortages, post-COVID burnout. Scaling workforces quickly inside a federal hiring system is also not simple. I think anyone who's done that before, like me, would agree it's a long process. It's very deliberative and it doesn't happen overnight. So taken together, medical demand and staffing demands threaten to absolutely destroy the system, right? Community care growth, staffing strain. This is the problem that restructuring policy is designed to solve. You can see how it can come off the rails. If it's still not clear, we'll consider this graphic. This is a structural feedback loop. It shows how this tension would kind of play out in the real world, right? So you have, expanded eligibility. It increases demand for obvious reasons, right? Well, demand then will meet staffing constraints. Well, with that wait times rise. Longer wait times trigger community care referrals. That's going to go up. Now, here's the important nuance you don't see in the misleading headlines out there about this debate. When community care grows, VA dollars are funding it, and the VHA is still managing it. These patients aren't leaving the VHA system. They're just being basically outsourced. So this is really just a reallocation of money externally for the delivery of services. In the case of a reallocation, we ask, who is the bill payer, right? You always have to ask that question. Money doesn't grow on trees. It has to come from somewhere, right? Well, honestly, it's not really clear, but it appears to be internal staffing. So it's fair to say the VHA will meet the future demand via external referrals. This is not ideological, it's system mechanics. And to be as clear-eyed as possible, the risk is not privatization by default. The risk, if internal capacity does not scale alongside external reliance, is imbalance. Now look at the split screen. This is where advocates of these changes and the critics diverge. Supporters of the reform argue community care expands choice. But let's think beyond the headlines here. Veterans cannot simply choose any civilian doctor without eligibility. Care generally must be authorized by the VA first. Providers usually must be in the VA community care network. So what you get is expanded access to private healthcare. But remember, this is VA money, so they're going to maintain control. Supporters also argue hybrid public-private systems are normal in modern healthcare. That's true. And consolidation reduces bureaucracy. In most cases, that's absolutely true, but not always. A veteran shouldn't be tied to a single provider system. Now, then there are the critics, the people on the other side of the argument. They say that too much reliance on community care may hollow out internal VA expertise. And why is that important? Veteran-specific care may not be easily replicated in the private sector. So what they're basically arguing is that, hey, there are very unique needs of a combat veteran in terms of healthcare, and that resident expertise should reside inside of the VA. Like for me, when I do my VA appointments, we talk about some of the things that are linked to my service connection, right? And so that's their big argument, is that if you outsource too much, you're not going to receive the kind of care that the institution of the VA can deliver because of their experience and years of collecting data and years of experience in treating combat or service-related injuries. The other also say that consolidation could centralize authority. I think that what they're saying here is that with fewer regional systems, what you're going to have is basically one boss that's going to be able to dictate things that happen within the region. Staffing reductions during expansion, they also send mixed signals, which is an interesting point because on one hand, we're saying that we're supporting veterans, yet the VA at the same time is reducing staffing and again, not providing that level of domain expertise care, right? So, but what I will say is this, both sides agree that veterans deserve timely, high quality care. What they're disagreeing on is structure and balance. And this is an important point. When you look at some of this crap out there in the political space about, pros and cons of these proposed changes, when they start accusing one another of like not caring about veterans, right? That's like a poison pill in politics. Just disregard it because it's garbage. Okay. It's meant to appeal to your emotions. It's meant to appeal to your bad side. Okay. As I look at systems, I always try to identify failure modes, right? A failure mode in simple terms is the specific point where the system breaks, right? So where the whole thing goes off the rails. Now, when people talk about reforming the U.S. Department of Veteran Affairs, the conversation tragically turns into a political fight. It's killing us, man. But there's a better way to analyze this, guys. I think it's up through failure modes. A failure mode is simply the way a system breaks. And if you want to take veterans' healthcare seriously, you should be asking two questions. What are the failure modes of the current system? And what are the failure modes of the proposed system? Because every system has them. If there was a perfect solution out there, we'd already have it. So let's first talk about the failure modes of the current VA system. The first is access. See, if the VA doesn't have enough doctors, specialists, or appointment slots in a region, veterans can face long wait times. We hear a lot about this. That's not a theoretical problem. It's exactly what drove Congress to pass the reforms expanding community care in the first place. Now, second is geography. Many veterans live far from many VA medical centers. If the closest facility is hours away, the system becomes difficult to access, even if the care itself is of high quality. And the third failure mode is the bureaucratic friction. Large federal systems can move slowly. Scheduling, referrals, and administrative processes sometimes create delays that frustrate veterans trying to navigate the system. And those are real failure modes. I mean, they're widely publicized. I think many of us who've gone through the system can understand that because we have experienced them. Now, consider the failure modes of the system that's being proposed, one that relies more on private sector care. And the first one is capacity. If a large number of veterans shift into civilian healthcare system, the question becomes simple. Does the private system actually have the capacity to absorb them? In many regions, especially like rural areas, the answer may already be no, right? It's important. If you are a listener from a rural area, this is a critical point. Second is fragmentation of care. Now, the VA is one of the largest integrated healthcare systems in the world. If veterans are spread across dozens of private providers, well, coordination becomes harder, continuity of care can break down. Third failure mode is a loss of veteran-specific expertise. We've already talked about that. VA deal every day with this kind of expertise counts. It develops because the system treats a large number of veterans. If too much care moves outside the system, then that concentration of expertise can erode. So the real question you might consider when thinking about the policy shift isn't simply VA versus private care. Not helpful. The real question is, which system's failure modes are more dangerous for veterans? And how do we design a system that reduces both sets of risks? Because if we're serious about veterans' healthcare, and we should stop treating this like a partisan argument and start treating it like what it actually is, a systems design problem. Now, this is where things might get a little controversial, and I try to steer clear of this crap. But in this case, I think setting context is important. I want to give our listeners the most complete understanding of not only the changes that are being implemented, but also why things appear so much more difficult to solve than they probably should be. Why are things so contentious about this? It's insane. Look at the headlines, man. Look at the debates on Capitol Hill. I mean, imagine trying to get anything serious done in this kind of environment. Remember when we talked about like the history of VA reform? Well, to be honest, most of that work was done in a more functional political system where tough problems were worked out through debate, argument, and compromise. But what's coming with the reforms is something very different. So why is everything so contentious? Well, for me, it comes down to trust. Remember the whole fiasco with the VA effort to roll out changes to the framework for adjudicating disability rates? We talked about that a couple of episodes ago. I'll put that down in the link below. Well, communicating those proposed changes via an announcement in the Federal Register rather than with transparency was at best incompetent. At worst, it was a cynical way to sneak it past the hill and most critically, the veterans you're responsible for caring for. I mean, that was a trust moment, in my opinion. Remember Secretary Collins' bellicose social media campaign via his official handle? You know, those posts that were very partisan while he serves in a position where his patients, many of whom don't share his political positions, feel uneasy about their prospects for care. It's totally understandable. And the same can be reasonably said about the workforce, who might feel that his tone is a direct threat to them when all they want to do is take care of our veterans. And yes, there's also the whole thing with Project 2025, where many of these recommendations were laid out. Now, to be clear, like, I haven't read Project 2025. I'm generally aware of like the controversy around it, and I'm definitely aware of kind of the tone and the vibe around it. Right? It's become a political hot potato, and I'm not going to offer an opinion on Project 2025. I did, however, in doing my research, I read the portions relevant to the VA, and to be honest, I found a lot of it to be quite logical. Some of it I just outright agree with. But the issue is that much of that message is just drowned out by the larger controversy about the initiative, which actually I think is yet another own goal, allowing good ideas to suffer the sins of shitty rollouts and shitty politics. So that's why this debate is probably way more contentious than it should be, and it makes thoughtful and logical reform much harder than necessary. And that's called leadership. That is the challenge of a leader, bringing different people, maybe with different views, different goals together and marching toward a common vision. Literally, dude, that's the job of a leader. So where do we currently stand with the implementation of these changes? Is there anything I can do? I mean, they're already launching them. Well, at this stage, what's being discussed appears to be an internal administrative reorganization inside the department. That means that the Secretary of Veterans Affairs has significant authority to adjust management structures, including regional networks, without needing brand new laws passed by Congress. And that's the administrative authority that he has. However, Congress still controls funding, and Congress retains oversight authority. So the question is, what can you do? Well, if you support or oppose these changes, your opinion matters. You can call your congressional representative's office or even email them. Congress controls the purse strings, and if organizational changes require statutory changes, Congress must fund them. So that is your leverage. So you can also contact your senator's office, as the Senate's responsible for approving leadership positions at the VA and approves funding. You can also send your concerns or your recommendations to the veteran service organizations to advocate on your behalf, organizations like the VFW, American Legion, etc. The point is, your voice does matter. And there's no better example of that than the response to the VA's attempts to change the disability framework that we've already talked about. Secretary Collins heard your voice and he pulled it down. To help y'all out, if you want to reach out to your members of Congress, maybe don't know what to ask or what to say, I've attached some questions that you can send to your congressional leaders and VSOs in the description below. If you find that useful, hopefully you do. I just want to take a moment to share that my thoughts and prayers are with the men and women serving in harm's way tonight. Nobody has a crystal ball, so we don't know what the future holds. What we do know is that war is a serious thing with lifelong implications for those responsible for carrying them out. I think we can all rally around the idea that what they are being asked to do is extraordinary with grave consequences. And for that reason, they deserve our respect and they deserve our thoughtful support. So with that, have a nice evening. Be good to one another.